is a bad idea, and I will explain to you why this is. The birth of a child could cost $7,737 for a vaginal birth and $10,958 for a C-section, provided there are no complications at birth. The cost of a child in their first year alone costs $10,625. That's just in the first year of life. Cost of raising a child from birth to age 18, unless they go to college, costs $190,528. Kids are expensive. The cost of putting a child through college costs up to $132,000. If they go to college, you are responsible for them until they are 23. And that is from the USDA.gov website. Fathering a child out of wedlock could cost you to lose up to 60% of your paycheck. Doesn't leave much for you after that. If you choose to just walk away from this and try not to take any responsibility, you could lose your driver's license, your house, your car, any of your professional licenses, your passport, and you could even go to jail. Premarital sex can also cause unwanted emotional attachment because many people confuse sex with love. Some of the unwanted problems due to premarital sex would include unplanned children, unwanted STDs, and sometimes loveless relationships. Children aren't the only consequence of having premarital sex. There are a host of STDs you can get from doing this activity regardless of the protection you use. Some of the STDs that you could get by having premarital sex would be gonorrhea, which is, I don't have a picture of that. Okay. Gonorrhea in men can, actually in both men and women, would be like a green pus-like discharge from either the vagina or the penis. It can also cause like sterility, some of the scarring and surgery in some severe cases in women. Then you have syphilis. Syphilis is right here. There's some syphilis. And then you can also get syphilis of your feet and on your hands. It's just a rash. It can also, affect the rest of your body. Some of the long-term effects, some of the damage that can happen from syphilis would be, in men, it can cause like brain disorders, some heart disease, blindness, dementia, and death, and that can also happen in women as well. In women, it can also cause some birth defects or death in newborns if the mother is infected with syphilis. You can also get genital warts, and here's some genital warts up here. I don't know if you can see that or not. Okay, genital warts. That can cause, warts either in the vagina or even on the men's penis, so that can also happen. And then you have genital herpes, which is right here. There's some herpes on here, and that there are lesions that appear in the at the site of the infection area. So when you're infected, then those lesions will appear in that area. In both men and women, it can cause, there are continuous outbreaks. They don't go away. I mean, even though you may be cleared up, you can still pass it on, even if you don't have an outbreak. And then you have HIV. HIV is an immune deficiency, and that it can cause a fever, sore throat, fatigue, swollen lymph nodes and glands, and that's pretty much once you get that, you're stuck with it. It doesn't go away. There's no treatment for that. Then you have chlamydia, and here's some chlamydia that also causes a pus-like discharge from the men and women. It can also cause sterility in both men and women. And then you have the hepatitis B. That often, usually you don't have symptoms, So, I mean, that is something that can, like, not show up, and then once it does show up, it's a, one of those things that you don't know how long you've had it or anything like that. Then you have the HPV, which is the human papillomavirus. That, in men, can cause wart-like genital growth. And then in women, there's often no visible signs on that. So in women, we don't know if we have that or not, unless they do a test, and then it's like, it shows up on the test, and then it's a shock. Some of the damage that can happen from that would be cancer of the penis and the anus. Then in women, it can initially be, pre-malignant changes. Then it can develop into cancer if it's not found or treated. And then you have the pelvic inflammatory disease. And that disease only affects women, doesn't affect men. That can also have, the PID can have some of the symptoms of chlamydia and gonorrhea. So it's easy to mistake that for something that's not, which is not exactly a good thing. And then some of the damage from the PID is ectopic pregnancies, which is a tubal pregnancy. So that's kind of painful from what I understand. And I got that from the Sexually Transmitted Disease resource from herpescoldstores.com. And if you would like to know how to avoid this, it is rather simple, and it's called abstinence. And that's just merely refraining from having sex of any kind. However, once you are married, it is okay to have sex with your spouse and only with your spouse. That way you're not infecting each other. Because when you have sex with somebody, you're not only having sex with them, you're having sex with who they've had sex with and who they've had sex with. So you're having sex with everybody when you have sex with somebody, in essence. As you can see, having premarital sex is a bad idea. There are many risks associated with premarital sex, such as STDs and unplanned children, and some unwanted emotional attachments. Therefore, to avoid any of this, practice abstinence. You will thank yourself for this in the long run. Abstinence is the best way to avoid anything bad, anything wrong. But it's something that everybody should practice, regardless of your age. If you wait and wait until have sex until you're married, then you know that you're safe because you haven't had sex. Hopefully your spouse hasn't had sex. So then, if you wait for each other, you don't run the risk of having sex with the wrong person, touching something that you don't need or don't want, and you don't have kids and unplanned children and things like that. And then it'll cost you less too because you don't have extra kids to have to take care of and extra STDs and extra problems to take care of. So hopefully abstinence is what you guys will choose to do, and it's the best policy.